It's very hard to predict timeframes in an outbreak as complicated as this, with so many variables that are outside our control. But certainly we're planning on at least another 6 months before we could declare this outbreak over, and that will change and vary as we get more information on a daily basis. So there are several hundred what they call tradi-modern or traditional modern health facilities in Beni. They have never been mapped, they're not regulated by the Ministry of Health, they're private facilities that are really business ventures. And those facilities are, we believe, one of the major drivers of the ongoing transmission. Probably more than 50% of cases in Beni have been driven from these tradi-modern healthcare facilities, and the fact that hygiene and injection practices in these areas are relatively unsafe. Because cases are occurring and are not diagnosed in these tradi-modern centres, they're leaving undiagnosed, perhaps being treated with an antipyretic for their fever, and there's no documentation in these tradi-modern facilities of the other patients who are exposed. It makes contact tracing much more complicated than traditional contact tracing in rural areas. So that's really caused some of the problems we've had in our contact tracing work.
Au guidon dans l'appareil photo.
But we are working with all elements of community members, both through mass mobilization techniques, but also through individual house-to-house techniques and mobilizing community members themselves. Increasingly, we're looking at youth and women's groups, including what's called the Tante de Rue, the aunts of the street, who are powerful local figures in neighborhoods who really actually form or help form public opinion. So they're all being mobilized in response, and we're starting to see some very positive signs.